from the great Salt Plains Health Center. She's been with us once or twice before, right?
Yep.
And welcome back, and we're going to be talking about maybe some flu stuff, but mainly cold weather seems to introduce, I don't know, colds and flus and stuff like that. So thanks for being here and help us out. So Sarah's got a list of 27 questions for you. So here we go. Number one.
Good morning, Dr. Maya. We're very glad to have you back, so welcome back. I know with the cold, like Steve was talking about, we tend to get, colds and everything. So do you tend to see more patients during the winter months versus the summer months?
Yeah, definitely. With the colds coming in, you basically get more people getting flus and feeling sick and needing to see their doctor. We also end up seeing more people for chronic conditions like if they have lung diseases, those can sometimes act up over the winter. People with arthritis tend to have some more pain over the winter, and I'll be seeing more of them. And also people with depression and anxiety, especially around the holidays. So I end up seeing a lot of patients about those issues as well.
We'll talk about that just a little bit later on, Dr. Bass, about how maybe cold weather or cloudy weather influences people and stuff like that. But a few years ago, I couldn't even spell allergy. And it seems like I'm the king of allergies anymore. Seriously, I didn't know what people, when they said, oh, I'm dealing with allergies, I had no clue what they were going through. Now I know. But my challenge is sometimes to find out, is this a cold or is this allergies? What are some signs to help us figure out? Because when I feel like it's a cold or allergies, so I go stand at the counter at the store, I don't know where to go. Is it allergy stuff I need to take, or is it cold stuff? So help us out. What's the difference?
Yeah, so with allergies, you're looking at something that's going to last a long time. Tends to happen with changes of season, so when the pollen counts are higher, things like that. And think of it like itchy. So you're going to have itchy eyes, you're going to have itchy nose, itchy back of the throat.
Allergy.
That's allergy. Typically, if you do have a little bit of a runny nose, it's going to be clear. Colds tend to be more like swelling and hurting. So you'll have swollen sinuses, which will make you feel that really thick congestion in your face. You'll also can have some sore throat and feel a little bit more run down. And colds tend to be a little bit shorter than allergies. The symptoms start within a day or two, and they typically don't last for more than 10 days, although occasionally you can have the cough kind of linger for a couple of weeks after a cold.
Well, that helps me because I've just always battled what's the difference. And I feel like sometimes I'm taking the wrong thing. It may be allergies, but I'm taking cold stuff. Okay, thank you.
Well, I used to never be sick and never have allergies, but then I moved to Oklahoma and I was like sick all the time.
Yes.
And I, at some point, got to learn, how to tell allergies and how to tell a cold. But last year was my first year actually taking the flu shot. Do you recommend the flu shot?
Definitely. The only way to really prevent getting the flu is to get the flu shot.
Okay, I have never taken a flu shot. In my 100 years of being around, I have never had a flu shot. No, that's for someone else. But seriously, I just never did mess with it. So who should get one? You're saying, yes, by golly, you should get the flu shot. Is it from 12 years to 102, or who should get that flu shot? And is there anyone who should stay away from a flu shot, really?
Okay, everybody over the age of 6 months can get a flu shot. So everyone should be getting an annual flu shot if they're over the age of 6 months old. The only people that shouldn't get a flu shot is if they have an allergy to some component of the flu shot, so some part of it. Typically that's people with egg allergies or have had an allergic reaction in the past. And occasionally if you have a latex allergy, it's really important to tell your pharmacy or your doctor to make sure you get a flu shot that doesn't have any latex in it.
I know Sarah's going to ask you a little bit more about the flu here in just a moment, but besides not getting the flu, why does a person need to take that flu shot?
Right. So you're not only protecting yourself, you're protecting people around you.
Okay.
The flu is very contagious.
Okay.
And like I said, only people over 6 months old. So if you're going to be around a little baby, you want to get the flu shot to protect that baby from getting contact with the flu.
Okay. All right, you won me over.
Yes.
I'll do it next year.
You can still get it done now. It's still worth it.
got time,
You
Steve.
still have time.
Here on
Flu
the show.
season just
Here
started.
on the show. Just stick it right there.
Should have told me. I would have brought one.
Can you tell us a little bit about the symptoms that we would find with the flu?
Yeah, so fever, and so in the medical community, we think of a fever as a temperature over 100.4, as well as body aches. That's very common, so your whole body just feels awful. Swelling in your nose and face to get that congestion feeling, a cough, and sometimes a sore throat.
Can a diet help us prevent the flu?
So there's no diet that specifically prevents the flu. The only way to prevent it is by getting the flu shot, doing really good hand washing and hygiene, covering your face when you cough so that you're not spreading the germs. And otherwise, they've shown that there may be some benefit to vitamin C and zinc in shortening the length of colds and flus, but really the data is behind getting the flu shot.
There it is, Steve.
Well, I was hoping that more pizza would
Yeah.
be a part of the diet that would help out and stuff like that. You had touched this a little bit earlier. Let's back up a little bit about changing of the seasons, especially in Oklahoma. You know, it can be 72, the next day is 32, and then it's windy and from the south and stuff's blowing in the air and stuff like that. It seems like, you know, just here recently, we've had like 3 or 4 days of just cloudy, dreary, misty kind of weather. And what kind of impact does that have on folks? You know, as a doctor, as you see people, they say, boy, sure wish I could see the sun. I mean, does the weather have a play in this?
Yeah, the weather does have a little bit of a play. Cold, dry weather actually allows for viruses like the flu virus and the viruses that cause the cold to be more prosperous, so they're around more often. The cold can actually cause increase in people's blood pressure just because of the way the blood moves into the center of the body and away from the hands and feet to protect it. Cold, short, dark days actually increase the rates of depression. And overall, just being closer together inside, you know, kids in school just spreading germs around and things like that. So yeah, the winter months do come with a little bit more sickness.
Very good. I know you were talking earlier about recommending everybody to take vitamins. I have a 1-year-old. At what age do you recommend they start taking vitamins?
So the multivitamins, really the best way that you can get the nutrients and vitamins that you need is actually a balanced diet. So making sure that your kids are eating their vegetables, their fruits, their lean proteins, their dairy, their whole grains, those things are actually going to get them vitamins and nutrients they need. People that have issues with either their bowel disease or have had surgeries, they might not absorb nutrients as well and may need vitamins. So it's actually best to kind of talk to your doctor about it because they know what medications you're on, they know what diseases, chronic diseases you may have, and what the best vitamins are for you. The other thing is the vitamin industry is not as well monitored as medications. So just because it says it on the bottle doesn't mean that's what's inside. One organization, USP, actually does monitor. So if you look at your vitamin label, make sure it says USP on it so you know that vitamins are actually contained in that pill. So you're not just spending your money on a sugar pill. But yeah, talk to your doctor about what vitamins are best for you because they do interact with medications. And some people, if they're getting a well-balanced diet, don't even need them.
Oh, good.
You sound like, excuse me, you sound like a physician that I knew in Tulsa, Oklahoma, would run with in the mornings during training runs. And I would say, Dr. So-and-so, and I said, what about this vitamin stuff? I wasn't taking vitamins or anything. And I said, what about this vitamins? And my wife did. He goes, Steve, if you eat right, you don't need to be taking these vitamins. And that was just kind of his mindset as well. If you're doing the balanced diet and you're eating right, you're getting all the nutrients you need. So he wasn't a big proponent of vitamins, but then I have another physician friend that's very active and stuff like that. He goes, you need to take D, E, Z, M, Q, I mean, just the whole list of things. And so I guess there's just different varieties. But I think that's important. What you said is that it's important that you check with your physician that knows everything that you're saying and said, you know, Steve, maybe this vitamin D or E is good for you or something.
Right, exactly.
Being 100 years old and everything, you need to take certain things. So
Right.
we have before we end our show, and again, our special guest here at the round table this morning is Dr. Maya Bass from the Great Salt Plains Health Center, and she's been with us 2 or 3 times before. Opioids is a topic in the legislature, it's in the news, it's everywhere. Can you speak, not necessarily on behalf of the medical profession, but from your experience, Dr. Bass, what steps are you as a physician and others taking to deal with this? You call it crisis, you can call it epidemic, but it's just a serious deal.
Yeah, we're actually taking a lot of steps at Great Salt Plains Health Center. We're working on finding other ways to help people manage pain. So we're coming up with a pain group where we'll use therapy and meditation and yoga to kind of help people deal with their pain without using opioid medications. So that's the first step, trying to find other options. If you are on opioid medications, doing safe prescribing practices, which means checking pharmacy logs to make sure that patients are only getting medicines from you, making sure your patients are on the lowest level of opiates they can, and if they are on high levels of opiates, making sure your patient has access to Narcan or naloxone, which is the antidote to opioid medications. By having this in the house and having a family member trained in how to use it, if one patient did have an overdose, a loved one could give them this medicine. It would wake them up long enough to get to the hospital to get care, and this is a medicine that could save lives.
I can see we can spend another 15, 20 minutes just talking
Easily.
on that one particular question. So,
Yeah.
Dr. Maya Bass, thank you so much. It's good to see you. And oh, by the way, a new bride. Can I say that here on television? We want to say congratulations to you and your husband. And
Thank you.
so congratulations on that. And by the way, it was a oceanside wedding, I think, in
Yeah.
New Jersey. So
Definitely.
anyway, congratulations and thanks for being with us.